Welcome to Module 7 of the Horse Council of British Columbia Emergency Preparedness Training Series. In this module, we are going to discuss animal health, including triage, treatment, and euthanasia. Animal health is a critical part of an emergency event. There is a significant increase in the risk of an animal getting sick or becoming injured during the event itself, during evacuation, or while at an evacuation site. This module is only intended to give volunteers and coordinators a brief overview and some general guidelines in regards to animal health. Ideally, animal health will be overseen by an animal health specialist, such as a veterinarian or an animal health technician. For that reason, it does not go into great depth in regards to diagnostics and treatment. There is a brief overview of emergency first aid until an animal health specialist can attend to the animal. As with each module, we will start by identifying risk and what we can do to mitigate it. For animal health, risks include the handlers being bit or struck by an animal, the spread of disease from an infected animal, pain and suffering of an animal from injuries, the ability to manage and control medical and pharmaceutical supplies. During euthanasia, there is a risk to injury to the handler from an animal thrashing or striking out during the act of euthanasia, risk of gunshot ricochet when using firearms, as well as risk of injection of barbiturates, and the risk of injury with a captive bolt gun. Risk can be mitigated by only using skilled equine practitioners such as veterinarians or certified animal health technicians who are experienced in not only animal health but also equine handling. You will want to implement good biosecurity practices, including segregation, isolation, or quarantine of sick animals. Keep in mind that these animals are coming from all kinds of farms and facilities that will have a varying degree of animal health standards. Unhealthy-looking animals should be segregated from all other animals as you do not know their health status. So you want to make sure that the location of the animal health facilities are appropriate for triage, treatment, segregation, and euthanasia. You will want to keep all medical and pharmaceutical supplies in a secure area and track inventory. In regards to euthanasia, only acceptable and effective methods of euthanasia can be used by individuals who are trained and experienced in euthanasia. There are several considerations for your animal health plan. We will start with who is going to oversee it. Ideally, this will be overseen by a veterinarian and certified animal health technician with assistance by experienced equine handlers. Triage, treatment, and euthanasia is an area that requires medical skills and experience in emergency treatment of animals for the welfare of the animals, the safety of the caregivers, and for liability reasons. Your organization should consider providing equine first aid training to all transporters evacuating and volunteers who will be assisting in the animal health area. The animal health area should be located where the animals can be protected from the elements, ideally inside a stall or a barn. It should be located at the front of the evacuation site near the check-in or check-out point so equine can be inspected before entering or exiting facilities. And so they have to walk the shortest distance possible and they do not have to come in direct contact with other animals. Biosecurity practices should be implemented. This includes having an isolation area available. A good example for the need for this would be if you have a horse that arrives at the evacuation site that is showing signs of strangles. Strangles is very contagious, and the horses should not intermingle with other animals. And for euthanasia, the primary consideration is which euthanasia method will be used and what equipment will be required. The method of euthanasia will impact the dead stock disposal, as you can see on this chart to the side. We are now going to discuss the preparation aspects of your animal health program. The first step to preparation is to identify the known hazards, what the health implications will be, and what are the indicators to look for with the different exposures. This will help you identify what resources you will need based on the most likely health conditions you will be looking for. We will look at the two most common ones for British Columbia, fires and floods. As you can see on this chart, for fires, the main impacts on animal health will be smoke inhalation and burns. Indicators of smoke inhalation include discharge from their nose, coughing, and swelling around their throat and neck area. They may also struggle to breathe. Burns are indicated by actual damage to the skin. During a flooding event, animals are at risk of drowning and hypothermia. Horses would need to be monitored for shaking and shivering, a body temperature below 37.8 degrees Celsius, and an irregular heartbeat. They may also be very lethargic. Here is a very general list of suggested triage supplies. Ideally, your animal health coordinator will be an animal health practitioner who will have access to all the necessary first aid supplies they will need for treatment. Non-medical items include a camera so you are able to take photos of the animals for your records and if the horse passes. We realize all phones have cameras, but a Polaroid type camera will allow you to have an immediate printed photo. If you use a cell phone, make sure you organize the photos and make copies. You will want to make sure that water is easily accessible for the triage treatment area and that you have enough buckets for the animals. Large tarps may be necessary to provide protection to the sick animals or to block the view of sick animals. You may also need to use the tarp to move a sedated horse, a deceased animal, or to cover dead stock. Signage will need to be posted to indicate where the triage and treatment areas are or to restrict access to those areas. You will also want to make sure that there is lighting present in the area for observation of the animal and also that it is good enough to be able to see the animal for treatment, especially at night. Applying stitches by flashlight is not ideal. And finally, you will need a means to move dead stock to the dead stock holding area. Here is a list of a very basic first aid kit that each transport vehicle evacuating and transporting animals should have in their vehicles. Each evacuation site should have one of these at a minimum also. Keep in mind, this is a very basic first aid kit to temporarily treat an animal until you can get them to an animal health technician. They should be restocked as needed during the event. For this reason, each site should have extra first aid kits or materials so a transporter can restock any materials they need when delivering animals. Your kit should include bandage, scissors and fetlock shears, saline solution, sheet cotton, a small sponge, vet wrap, sterile gauze pads and rolls, disposable diapers or sanitary napkins, duct tape or electrical tape, safety pins of assorted sizes, a cotton terry towel, and sports medicine tape. In preparation for the evacuation event, you will want to identify who is going to be your animal health coordinator. This is who will be in charge of animal health during the event. Ideally, this is arranged with a local vet clinic or multiple clinics and is at a minimum overseen by animal health technicians. Once they are identified, you will want to coordinate with them what supplies are going to be required and what they can provide, such as first aid material and necessary pharmaceuticals. You will then want to identify what you may need to help them secure, such as access to water, bedding, or water buckets. The previous slide provided supplies for consideration. You will want to identify the location of the triage and treatment area at the evacuation site, remembering that it needs to be easily accessible, have good lighting, ideally a power source, the ability to segregate sick or injured horses from healthy animals, and will protect them from the weather. You will also want to have an area designated for the unloading of sick or injured animals near the triage area. You will want to identify a secure area for medical and pharmaceutical supplies. Identify who will oversee euthanasia and what methods will be utilized at the site. This most likely will be the person or persons in charge of animal health, but you will need to verify what their capabilities are. And as discussed in Module 2, you will need to outline the process of disposal of dead stock. And finally, determine who will create and be responsible for the record keeping for all animal treatments. Meetings should be held with all transporters before an emergency event occurs. One of the things you will want to discuss is animal health protocols for transport. Providing them an information sheet with the following protocols and necessary phone numbers is highly suggested. All transporters need to be instructed to contact the animal health coordinator before loading an ill or injured animal. The transport of any ill or injured animal should be done only under the direction of an animal care technician. If the animal health coordinator is not available, then the evacuation coordinator needs to be contacted. The transporter will need to relay the condition of the animal to the coordinator, and if there is any question on the animal's fitness to be transported, they must speak with an animal health technician or veterinarian. Upon arrival at the evacuation site, the transporter must notify the site coordinator that they have an injured or ill animal on the trailer. The animal cannot be unloaded until a member of the animal health team is present and can evaluate the animal before it is unloaded, so they are able to triage them and determine actions for the animal. As an example, a diseased horse will need special protocols for unloading. Or an animal that became non-ambulatory during transport will need to be treated or euthanized before being unloaded. It cannot be forced to stand or be drug off the trailer. We are now ready to implement the animal health program. Once you are aware that evacuation notices have been issued, you will begin site preparation. Part of this setup will include your animal health area. First, you will need to contact the animal health coordinator to notify them that you are setting up to start receiving animals so they can implement their plan and begin their preparation. You will need to set up your predetermined triage and treatment area for receipt of animals as outlined in the preparation part of this module. Any stalls and handling areas you will be using will need to be thoroughly inspected for any areas that can injure an animal, including sharp and protruding objects, holes in the ground, wires, broken gates or hinges. You will also want to bed the area as necessary. Signage, including a sign identifying triage and treatment area, along with signage designating restricted unloading area and restricted access to triage and treatment areas. And finally, you will also need to assist the animal health coordinator as required when they arrive and start setup. There are 2 triage areas that will require implementation. One is for the evacuation site, and the other is for evacuation itself. When animals are picked up, the transporter is going to have to do a quick evaluation of them. If they have an animal which is showing signs of injury or illness, they will need to discuss with the animal health coordinator if there is no immediate treatment necessary, that the animal will need treated where it is, to move the animal to another location, or that the animal needs humanely destroyed. Here is a list of indicators that an animal may be experiencing pain or distress. Do they have glazed eyes, staring, or droopy head? They show little interest in the surrounding or other animals. They are reluctant to move or have the inability to stand or difficulty standing or moving. They are showing signs of lameness, swollen limbs or joints. They have an open or bleeding wound. They are standing in a rigid position with their head pressed against an object. They are grinding their teeth. They are vocalizing excessively. They are shivering. They have blood coming from their eyes, nose, or any other body opening. They have rapid or irregular shallow breathing or mouth breathing. They are coughing. They have any limbs pointing in the wrong direction or bones protruding from their body. Or they have loss of balance or lack of coordination, including staggering or circling. This picture on the right-hand side of the screen shows you what a horse looks like when they are in pain. They exhibit signs of pain face. When handling injured animals, you will want to utilize the following guidance. First and foremost, if the animal cannot get up or be transported without causing further pain or suffering, by law, it must be treated where it is or euthanized on site. It cannot be loaded for transport unless to go for veterinary care under the supervision of a veterinarian. If the animal is injured but can move, work slowly and quietly around it. If the animal has a halter on, or you are able to safely put a halter on it, be careful when leading it. Scared and injured animals can be very dangerous and unpredictable. Walk slowly and talk calmly to the animal. The quieter and calmer you are, the quieter and the calmer the animal will be. If the horse is loose and you need to catch it, walk calmly to the left side of the animal. And never yell or chase an animal. If it has been determined that the animal should not be transported and a veterinarian has been called, large animals are best left where they are until the veterinarian arrives. If the animal is able to walk, try to get it to a safe area until it can be attended to. If the animal needs to be moved for treatment or euthanasia, it should be moved the shortest distance possible. and if the animal cannot get up and needs to be euthanized, it'll be necessary to destroy it where it is. Injuries, distress, and pain can be difficult to detect in livestock. As prey animals, they are wired not to show pain, as this makes them vulnerable to their predators. Lack of visible emotion does not mean the animal is not in pain or suffering. Here is another example of the ways animals express pain and distress through their face. There may be circumstances where a transporter or evacuation site volunteer needs to apply the initial first aid to an animal during evacuation, upon arrival at an evacuation site, or while animals are in the care of the volunteers at the site. As stated earlier, ideally, anyone that may need to provide first aid will have some level of equine first aid training. Emergency first aid should be applied if an animal health specialist is not available or until the animal health specialist can tend to the animal. For basic first aid for an animal with an open wound or laceration, you will want to apply pressure to the laceration or wound to stop the bleeding. Open wounds or lacerations can be wrapped with sterile pads and secured with an ACE bandage or a product like vet wrap. Diapers, sanitary napkins, or towels can also be applied to limit blood loss, especially in cases of a wound with profuse bleeding. For animals with broken bones, such as a broken ankle, leg, or shoulder, or one with mobility issues, they should not be moved until a veterinarian can attend to them. An animal with a broken leg, ankle, or shoulder cannot be transported unless they are under the care of a veterinarian and they are being transported directly to a location to receive care. An animal that is having trouble standing or walking or is non-ambulatory should only be moved or transported under the direction of a veterinarian. Burns occur when animals have been exposed to fire or electric shock. Burns cause extreme pain, and animals should be handled with extra care, as the risk of shock is very high. All animals that were exposed to embers should be hosed off as soon as possible to prevent further injury. If a horse has been burned, after getting it to a safe zone and calming it, cold water should be gently poured over the burned area for approximately 10 to 15 minutes. When burns are extensive, meaning they cover most of or the entire body, or are severe, such as burns that are deep down to the bones and muscles, the animal should be humanely destroyed as soon as possible. As with humans, do not apply oils, lotions, or salves, and do not pick, blisters, touch, breathe, or cough on the injured area. Horses will need to be closely monitored as they have a delayed reaction to smoke inhalation. And if they have a nylon blanket on, be very careful removing it, as the blanket may have melted to the skin of the horse and will require to be cut off and the melted pieces removed by a veterinarian. For receiving at the evacuation site, once the evacuation site is notified by the transporter that the injured or sick animal is being transported to the site, the animal health team will begin preparations. Upon arrival, the transporter must notify the animal care health coordinator or evacuation site coordinator of their arrival and that they have sick or injured animals on board. The animal must not be unloaded until a member of the animal health team is present and can assess the animal for unloading, as discussed earlier. The transporter must follow the direction of the animal health coordinator at all times. Operational procedures should include that all animals in the triage treatment area are continually monitored during their stay to ensure that any changes in their condition is quickly identified. An animal can look good 1 minute and go downhill very quickly the next. The provision of feed and water for each animal must be coordinated with the person in charge of treatment. There may be restrictions with either one of these, depending on their condition and their treatment. You will want to restrict access to the triage and treatment area to reduce unnecessary stress to the animals, lower the risk of injury to volunteers, and reduce any risk of disease spread. All treatment records should be kept in a safe location and updated as needed. And they should also be provided to the owner of the animal at the time of its release. If emergency euthanasia of a horse is required when an animal health specialist is either not available or the animal health specialist does not have a means to euthanize it, a volunteer may be required to do it. This would be very extenuating circumstances and can only be performed by someone who is experienced and skilled in this area. This diagram shows you the correct location for the application of gunshot euthanasia. Now for a quick review of the key points from this module. Coordinate with an animal health care specialist to oversee the coordination and management of your animal health aspect of your evacuation site. A specific area of your evacuation site must be designated as your animal health area. Meet with your evacuation transporters ahead of time to provide them with directions on how to handle sick or injured animals that they may encounter during evacuation. And always show extra caution when handling sick or injured animals, as fear and pain elevate the level of risk during handling. We are now at the end of Module 7, and you can proceed to Module 8, Rescue and Recovery.